Welcome everyone to our healthcare industry session on Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. I'm thrilled to join you today during Ignite. I'm Tom McGinnis, Corporate Vice President for Global Healthcare. Today I'll talk about the current healthcare landscape and environment. I'll also introduce you to the Microsoft Cloud for Healthcare and share a couple of demos to showcase some of the latest capabilities that we're so excited about. And finally, I'll round out our presentation with a live chat Q&A session with a few of our subject matter experts. Right now, we're in a moment of crisis. Getting healthcare right is clearly more important than ever before, not only because of COVID-19, but also because many hospitals and healthcare systems, many of our customers, are struggling just to stay afloat. In the short term, these healthcare firms are being squeezed by plummeting volume and reimbursement on one side, much of this due to the cancellation of revenue-generating elective procedures. Those cancellations were as high as 70% in the second quarter and are expected to remain at a cancellation level of 45% this quarter. Many hospitals are also seeing costs rise on the other side to overtime, contract work, higher prices for supplies, and other challenges. Hospitals and healthcare systems are clearly bracing themselves system-wide for system-wide disruption and announcing temporary layoffs, reassignments, and pay cuts. With narrow margins to start with and a small amount of cash on hand for many of these systems, many hospitals will fail or seek solutions to drive critical improvements in the operating efficiencies in their systems to survive. Healthcare leaders must now begin shifting from managing the crisis, keeping the organization functioning, to managing the transition back to a restored future. That's going to mean mid to long-term economic scenario planning to understand the related impacts, whether it be on operations or employees, financing, or supply chain. And it's also going to require that mindsets shift. They shift from a primarily reactive mode to anticipating how to reinvent the organization for a successful future. For us, our purpose is clear. In every industry and in every country, we are committed to empowering every person and every organization on the planet to achieve more. Microsoft empowers healthcare organizations to achieve more by bringing our technology and products together into experiences that unlock value for our customers. That value is anchored in three primary areas: trust, scale, and security and compliance. At Microsoft, we are focused on trust, and we are always empowering our healthcare customers. And most importantly, we're not monetizing your data or your patient's data. And on top of all of that, we have industry-leading scale. With more than $15 billion invested in cloud infrastructure and more than 1 million physical servers across 54 global regions, we are also the clear partner of choice in healthcare. Because we bring the industry-leading platform and capabilities, we have the largest partner ecosystem in the market with more than 68,000 partners. This is more than all of our top cloud competitors combined. Finally, we have the highest levels of commitment for security and meeting industry compliance standards and certifications. We have the highest levels of commitment to trust and to security, and we invest more than $1 billion annually. Our Cyber Defense Operations Center brings together security response experts from across the company to help protect, detect, and respond 24/7 to security threats in real time. With more than 25 years serving healthcare organizations, our expertise is deep and our imagination boundless. Now, as we begin to transition from a reactive crisis management mode, which many of us are in, to a more proactive planning mode, we're going to see that these longer-term challenges come back to the forefront, and addressing them will be so key to a more resilient, successful future. And as you know, healthcare has been through a massive transformation during the past 6 months. In May, we announced the public preview of the Microsoft Cloud for Healthcare. This helps us and our partners address many of our customers' key needs during this challenging time. This ultimately supports and accelerates this important health transformation taking place right now. Toward that end, I am pleased to announce today that the Microsoft Cloud for Healthcare will be generally available on October 30th. This version, it's in its initial form, is targeted toward provider customers, but shortly following that launch, we will also focus efforts to develop targeted offerings for payers, for pharmaceutical firms, and for medtech firms. We know that the needs across these vertical markets are quite unique, but we also know that they are aligned to the end goal of improving patient and population health outcomes. So, how does the Microsoft Cloud for Healthcare help? In this initial release, we focus on the following 4 key areas. First, enhancing patient engagement and how we enable data to flow securely through every point of care to continuously improve patient experience and the ultimate health outcomes. Second, empowering health team collaboration by accelerating a health team's ability to not only coordinate care in a secure environment, but also to simplify complex workflow management. Third, improving clinical and operational insights by connecting data from across systems from our partners and creating insights to predict risk and help improve patient care. And finally, fourth, protecting health information to support privacy and effective security end to end. We also help manage compliance and evolving regulatory changes and improve data governance and trust on a continuous basis. The Microsoft Cloud for Healthcare connects the full set of Microsoft capabilities together in a healthcare relevant use cases like care team collaboration and virtual health. This enables customers like you to connect the data and applications you already have, but in new and transformative ways. These are 2 areas that we will be diving deeper into shortly. You are already using solutions from many of our partners in your business, and our platform helps you connect them in new and impactful ways. Let me show you some examples of how these capabilities are connected to help customers like you. The Microsoft Cloud for Healthcare can help you by enhancing your patient engagement with a 360-degree view of patient data. As I mentioned earlier, you are already running many systems in your organizations, often from Microsoft partners. We can now connect data from these systems and give you access to the most important patient details in a more connected way. We can also enable you to view care specifics, as well as historical interactions and clinical data through Patient 360. Key to these capabilities is the common data model. The common data model for healthcare is based on HL7 Fire with a direct integration to the Microsoft Azure Fire service. This ease of interoperability unlocks the EHR data and lets you share it when appropriate with your non-developer employees with the Power Platform suite. We also often hear customers how they're trying to build longitudinal patient records. The Microsoft Cloud for Healthcare can also give you full context into the patient's history, whether that be from encounters, allergies, conditions, procedures, and appointments, all of which will be fed from the EHR data repository and done in a common data model format that's built specifically for healthcare. Customers like you have also told us that they want to find new ways to connect with their patients, to engage them. The Microsoft Cloud for Healthcare can enable you to segment your patients based on their health attributes and interactions. This empowers you to build the right types of outreach programs for each patient group and to provide them targeted material based on individual profile and medical record data. And speaking of new ways of interacting with your patients, the Microsoft Cloud for Healthcare enables patients to start interacting with the Microsoft HealthBot. Patients can engage to have their care triaged appropriately, book appointments, and much more using the Microsoft HealthBot templates. From there, you can even jump straight into a virtual consultation using existing telehealth providers or Microsoft Teams. You'll see much more of our Teams capabilities in healthcare later in today's session. I mentioned earlier that helping with care coordination is a key focus area for us, and we know that this is critical for the industry. The Microsoft Cloud for Healthcare enables you to begin the day with a dashboard view of all the prioritized patient needs and appointments. Your care team members can focus on the right plans that need adjustments directly from that dashboard. They can then see the status of care plans with interactive and actionable insights. We also know how important home health and remote care is, particularly in a post-COVID world. Our automated scheduling capabilities can route the right healthcare worker to the right patient based on their unique needs. This uses the resource scheduling optimization capabilities in our Microsoft Dynamics platform. For your care team leaders trying to manage these resources, they can view and adjust the care team schedules from a streamlined resource management tool. Now, these are just a few of the new capabilities around enhancing patient engagement and care coordination, but there's so much more. We also integrate into the tools that help you empower your clinicians to provide the best care possible. I'm going to turn it over to Edgar Wilson, who will show us a demo of the Microsoft Cloud for Healthcare patient engagement. He's really going to bring it to life for us. Take it away, Edgar.
Thanks, Tom. Hi, my name is Edgar Wilson, and today I'll be walking you through the next level patient engagement experience that leverages the Microsoft Cloud for Healthcare. In this scenario, our patient, Claire Casey, accesses our patient portal. Here, she's able to schedule appointments, view messages, as well as find a doctor. Directly within the homepage, Claire's able to view all of her unread messages, any upcoming appointments, as well as medications and the number of refills that she has. She notices that she has an unread message from Dr. Anton Chu's office, noticing that she had missed an earlier appointment. Directly within this view, it lets her know that she also has the ability to schedule through a bot or directly through the portal. On the portal, she can select schedule an appointment, and directly within the portal, select the reason for that appointment. She can also search for the location that is closest to her for this appointment. Next, she'll need to select the appropriate date and time that work best for her schedule. Within the portal, she can go ahead and select the date, and it will list the physicians and their open slots. This leverages a robust integration between our Azure API for Fire and CDS, which leverages the Fire Sync agent. This ensures that any appointment that is booked is written back to the electronic medical record system or practice management system. Claire enters some detailed information about the appointment, and now she's set to be scheduled. Claire notices that there's also access to a chat mechanism within the portal. This is our Microsoft HealthBot service. The Microsoft HealthBot service contains a multitude of healthcare-specific templates to allow for patients to perform high-level triage. In this case, Claire is experiencing some issues with her COPD. Directly interfacing with the bot, she's able to view a wealth of information regarding symptoms of COPD. Through the bot, she lets it know that she's been having some shortness of breath. The bot then interacts with her in order to discern what the ailment might be and also what the next best action should be for this particular patient. It goes through asking a series of very tailored questions based on responses that she's received. At this point, it's uncovered what the next best action should be and wants some additional information before getting Claire over to someone that can help her. In this case, she specifies that she also needs a refill on her medication. It then escalates her directly to an agent. Care coordinator Molly Clark just wrapped up a conversation with Sophia Adney. Directly within the Omnichannel for Patient Service solution, she views the chat message from Claire. She then is able to access that message and can view the full transcript of the conversation that's taken place with the bot. Within the Patient 360 form, she also has the ability to view all of the appointments, allergies, interactions, medications, and conversation summary. She can also flip over to a more holistic view of this information in order to garner even more detail. From here, she's able to view all of the patient relationships, any conditions, medications, appointments, or allergies that this particular patient has. The care coordinator can also get a holistic view of this patient's clinical events in a sequential fashion through our timeline. This timeline allows you to interact with the clinical event data directly in context of the patient. Now that the care coordinator's had a chance to review the patient 360, the care coordinator can now converse with the patient out on the portal through the same chat mechanism where they were able to view the history of the conversation with the Microsoft Health Bot. The care coordinator noticed the shortness of breath comment through the bot transcript. Claire Casey out on the portal says she believes it's because of her COPD. In the right corner, you're able to see that the agent guidance has surfaced a knowledge base article based on the keyword COPD. Through our wellness coaching module within the Patient Service Center solution, provides the ability to surface knowledge base information specific to an individual patient's need. Directly through that same chat mechanism, we're able to send out this knowledge base article directly to the patient specific to their individual ailment. The patient also mentions the fact that she has some questions regarding her prescriptions. In the agent guidance, this flags the fact that there's a prescription refill reminder so that the care coordinator can take proactive action on refilling this prescription. Through our configurable platform, you're able to easily integrate with prescription management solutions. As can be seen through the demonstration, the Microsoft Cloud for Healthcare provides a holistic solution that lays a superb foundation to enhance patient engagement and also empower care teams with solutions that are very simple to use. Thanks for your time.
Thank you for a great demo, Edgar. I hope after seeing that demo, you are thinking about how your organization can engage with your patients and improve care management in new and exciting ways. Now, I'd like to take a few minutes to show you some exciting ways to empower health team collaboration. Microsoft Teams brings together great video, voice, and chat experiences that work across all devices, whether it be mobile, desktop, web, and wearables. It's clear how important these capabilities are in healthcare, which is why so many of our customers are now using Teams. We understand that clinicians need tools that are as easy to use as consumer chat apps, but with extra security to ensure patient health information is protected. With Microsoft Teams, all of your staff can communicate on one platform and do so with our secure messaging capabilities. Knowing who is on a shift and being able to reach the right person at the right time is so key to delivering timely and effective patient care. And targeting in Teams allows users to create flexible tags based on role or skills to target their communication to the right individual or group. Tags can also be powered by shifts. So when an ER nurse manages the on-call cardiologist, that message will only be delivered to the person that is currently working. Image annotation. Image annotation allows clinicians to take, annotate, and share pictures on a secure and compliant platform so that those images are not stored locally on the mobile device. What happens in Teams stays in Teams. When a message needs to be delivered urgently, a priority notification will ping the recipient every 2 minutes for up to 20 minutes or until the user responds. Care team collaboration also has gotten much easier with lists in Teams, giving the entire care team a smart tracking system to huddle and to collaborate on their patients. They can run processes like multidisciplinary team meetings, discharge planning, and much more. Tasks in Teams allows you to assign and track the work you need to get done across your work streams and across the organization. This gives clinicians and administrators a powerful tool to manage all of their responsibilities, ordered by due date or filtered by the ones that are marked most important. Teams can also bring approval workflows together in one place. The Approvals Hub makes it easy to request, approve, or reject approvals. It's also possible to integrate with e-signature services such as Adobe Sign and DocuSign to help you get the signature you need without ever leaving the context of Teams. Now, we all know that clinician schedules can change week to week. Instead of having to check paper schedules or review multiple systems, clinicians can now use shifts to view their schedule, submit time off requests, offer to give or swap a shift, and be instantly notified when requests are approved by their manager. Shifts can also be integrated with workforce management systems like Amion, Kronos, and Blue Yonder. In a recent report from Frost & Sullivan, the US telehealth market is forecasted to grow 64% this year. Pre-COVID, that forecast was about half, or 32%. This is a change we expect to last well beyond the pandemic. Virtual visits drives cost savings and improves access to high-quality care for patients. The industry is shifting to a virtual-first strategy. Microsoft is deeply invested in supporting this digital transformation towards virtual healthcare. Part of that telehealth workflow is the ability to easily schedule virtual visits and with visibility into the provider's calendar, and also to send customized emails to patients, reminding them of their upcoming appointment. And what I'm thrilled to announce is that coming soon, we are adding capabilities for SMS notifications for virtual visits. Now, we also heard that patients do not always want to download a mobile app to join a virtual visit from their phone. We're listening to that feedback. So we are now adding support for mobile web RTC so that patients can one-click join their virtual visit using their mobile browser. No app download will be needed. The scheduling capability with Microsoft Bookings in Microsoft Teams is available today. We are continuing to invest in solutions that leverage Teams to meet the unique needs of the healthcare industry. For instance, we're making virtual care even easier with the Microsoft Teams EHR connector. This connector will allow clinicians to launch virtual patient visits in Teams right from Epic, with support for more electronic healthcare records systems coming soon. In a recent McKinsey & Company report, healthcare providers reported 50 to 175-fold increase in telehealth patient volume since the onset of the pandemic. This demonstrates the potential for telehealth services to improve care access and quality, patient outcomes, and healthcare system efficiency. The report urged healthcare providers to act now to scale the use of those secure workflow integrated telehealth technology, incorporating virtual visits into the care continuum of care, and expand services to more patient encounters and medical specialties. To continue the conversation around Teams and healthcare, Daniel Canning will share the latest news around our partnership with Nuance DAX and integration within Teams. Take it away, Daniel.
Thank you, Tom. I'm excited to share a little bit about virtual health and care team collaboration with Microsoft Teams. My name is Daniel Canning, and I lead platform marketing for Microsoft 365 and healthcare. Microsoft 365 and Teams are revolutionizing the way care teams collaborate by integrating otherwise fragmented workflows in a secure and compliant platform, which can improve patient outcomes. Microsoft is deeply invested in supporting the current digital transformation towards virtual healthcare. Telehealth workflows include the ability to have great visit experiences with calendaring, customized reminders, and all of the meetings intelligence you get with Microsoft and Teams bookings natively. But beyond these great investments, Microsoft Teams is also a platform to extend virtual healthcare workflows with customer and partner IP and taking those workflows even further. A great example of this type of integration is the work that Microsoft and Nuance are doing to bring their Dragon Ambient experience into Microsoft Teams. This integration reduces administrative workload by allowing the clinician to stay focused on the patient. It uses AI-powered transcriptions, which are integrating with the Microsoft Teams meeting audio and video to be processed by leading healthcare AI. And then in the end, it can take that diarized document of the meeting and integrate it with the electronic healthcare record, auto-populating a highly accurate clinical note for the physicians to review and submit directly to the patient's medical record. Let's take a look at a demo of how this will work.
The Nuance Dragon Ambient Experience, DAX, securely captures and contextualizes physician-patient conversations, automatically creating clinical documentation for virtual visits, all within Microsoft Teams. This video shows Nuance DAX integrated into a Microsoft Teams virtual visit between Lucas and his doctor, Dr. Fernandez. The healthcare clinic scheduled an appointment for Lucas and Dr. Fernandez through Microsoft Teams and the Microsoft Bookings app. Lucas received an invite with a link to their virtual visit in Microsoft Teams. The patient joins the visit from their email and is admitted to the lobby. Meanwhile, Dr. Fernandez gets ready for the visit and has her calendar side by side with her chat. When she joins the visit, she sees that Lucas is waiting and admits him into the meeting. When the visit starts, Nuance DAX sends Dr. Fernandez a message. This separate conversation with DAX enables her to start, pause, and resume the recording. When the recording starts, a banner appears to alert the patient that the visit is being recorded.
Have you had this happen before?
During the visit, audio for DAX is securely captured through Microsoft Teams. The entire conversation is recorded and diarized with high accuracy, so nothing is missed, lost, or forgotten. After the visit ends, artificial intelligence automatically converts the conversation into a standardized, structured clinical note that goes through a brief quality review process to check for accuracy, omissions, and appropriateness before being delivered for signature directly into the electronic health record. Nuance DAX for Microsoft Teams promotes a better telehealth workflow experience for both patients and providers by powering virtual visits with clinical documentation that writes itself.
Bye.
What a great demo to see how Teams as a platform can be elegantly combined with the intelligence of Nuance's Dragon Ambient experience. Here's a link to join the preview of that DAX and Teams integration, and a few others to see additional healthcare partner solutions, or some links to go and start building your own solutions with Microsoft Teams. Thank you very much.
Thank you, Daniel. That's just one example of how Microsoft Cloud for Healthcare can transform both the provider and the patient experience during virtual visits. Now, before I close out our session, I would be remiss if I didn't take time to recognize that Microsoft Cloud for Healthcare comes to life through the combination of what Microsoft and our rich partner ecosystem are doing to build, expand, and connect patient and care team experiences across the cloud. Microsoft has always been a partner-led company, and you can see here just some of the partners we work with today. The Microsoft Cloud for Healthcare continues that tradition and enables those partners to help our customers derive maximum value even more quickly by providing the connected healthcare platform underneath them. As our partners continue to build on and extend our core platforms and healthcare capabilities, customers will realize those benefits and outcomes, the ones that are focused on improving the quality of care, increasing care team collaboration and communication, and fostering actionable insights to drive ongoing improvement. Applied behavior analysis, or ABA, is an evidence-based practice that helps children with autism spectrum disorder, helps them to improve communication and their social skills. An ABA practitioner works with the child and the child's family to identify goals and to help improve overall quality of life. This includes focusing on communication and social skills, as well as improving adaptive learning skills and decreasing any problem behaviors. While the work of an ABA practitioner is incredibly rewarding, the commitment required to effectively deliver ABA services is taxing. It's taxing across documentation requirements, care team collaboration, and data analysis. This can ultimately lead to burnout. Let's show you a video on how one of our partners, Chorus Software Solutions, helped Encore Support Services, an industry-leading behavioral healthcare organization caring for children with autism, improve how it managed the complexity of capturing information across different tools and applications, and how it used session insights continuously to improve the individualized autism care plans over time. Let's take a look at that video.
We are giants standing on giants' shoulders. We were accelerated and empowered by the Microsoft Dynamics Empower platform, and that's how we were able to get where we got to so quickly and so efficiently.
Applied behavior analysis is really focused on changing the environment to make lives of our clients better. So having good data really is the key to providing good care.
Working with a child with autism is strenuous enough. Technologies out there ended up being a burden, which contributed a lot to the physician burnout or care team burnout.
There's so much happening in a session when the behavior analyst is in the home. You're juggling many different tasks simultaneously.
Right now. Take a deep breath
When you're stressed out, it becomes even more challenging to implement any kind of services.
Providing ABA care is literally impossible without proper data. Without data validity and reliability, clinical decisions and modifications cannot be made. We figured that if there's nothing out there, we have to just create it ourselves. And that's where we started with our own technology journey.
Core specializes in building healthcare apps, and it was extremely crucial to have Dynamics as a platform to build our solutions. When we designed the app, one of the big factors was always one source of truth for all the data, so the clinicians could actually do whatever they need to with the least clicks possible. Frictionless experience with the app, and that's why we picked Dynamics, so we felt it could handle all of that in one place.
The first time we presented the real user flow to our researchers, some of them literally had tears in their eyes.
To see this app that was designed specifically for the needs of a BCBA is something that I still get excited about every day because it's so necessary. It's really, really been missing in our field.
I'm always a parent, I'm always a teacher, I'm always a therapist, but I appreciate that through this technology, there's always help, there's always somebody to back me up.
To have data and information flowing back and forth in a standard that's unified, especially when it comes to behavioral health and autism care, open up a new world of holistic care and working together.
To potentially work with more children because this app is taking away that huge amount of paperwork is something that I am so excited about.
It's not just a mobile technology or a platform that we're developing. It's technology that we're developing that has a direct impact on the progress that the children are making, empowering every child to achieve more.
As we close out our session, here you'll find resources for you to learn more about the Microsoft Cloud for Healthcare and our industry blog, where you can read more about our recent GA release. If you're interested in learning more about Microsoft's experiences in healthcare, we have some other fantastic Ignite resources. Here you'll find sessions about the Healthcare Cloud, first-line adoption of Teams in healthcare, Azure industry resources, and much more. In closing, this global epidemiological crisis has now forced payers, providers, patients, and a whole host of other health stakeholders to stress test digital modalities of deploying healthcare in the next chapter. I hope this session helped you understand how Microsoft Cloud for Healthcare's connected cloud is designed to specifically address that need, enabling your organizations with the speed and agility to adjust to change, to build resiliency that helps you weather today's challenges so your organization can begin the path forward to reimagine tomorrow.